My first question is, on August 2nd, 2023, this subcommittee sent the department a letter regarding a potential new guideline on COVID-19 booster shots. Assistant Secretary Igorin, the committee simply wanted to review the science and the supported statements made by the CDC director to the media regarding the boosters. However, no response and no documents have been received after sending this letter. Were you aware that this letter was sent to Dr. Mandy Cohen, the director of the CDC?
Congressman, I am aware that letter was sent to Director Cohen. I'm also aware that there was a briefing based on that letter providing information to staff within a month of us receiving that letter.
Did you identify points of contact in the CDC to get us a written response to this?
Congressman, we provided a briefing to the staff, and based on the prioritization, we have continued to work on other priorities of the subcommittee.
Did you ever intend to send any documents that we've requested regarding the CDC booster guidance?
Congressman, we continue to work on productions across all of the inquiries.
How many documents have you provided so far regarding this topic?
Concerning that topic, we have provided a briefing. We have provided.
How many documents have you provided? As this was a request for documents.
Congressman, we have provided a briefing with the information. If there
How many documents?
Follow-up, we are happy to work with you.
This is not a follow-up. This is something we've already requested. We've already requested documents. I hope that we can find a way to restrict your travel funds, to restrict your pay, to fence off some money to your organization. We're going to have to do something drastic. It's apparent that you have thumbed your nose, your organization has thumbed your nose at this committee with regards to the oversight responsibility that we have, and you've done everything you can to make a joke of our oversight.
If House Republicans weren't so desperate to find a shred of evidence for their members' unhinged conspiracies, they could be using this time and resources to actually save lives and prevent the next pandemic. But the majority is not interested in any of that. They're only interested in forcing their extreme ideology on the American people, whether it's kicking low-income families off their health insurance or gutting the right to abortion care across the country. Now, and let's also be really clear, these policies have been proposed not just by the Republican majority, but also by their Supreme Leader Donald Trump. Well, thank you, Mr. Chairman, and I want to thank the Assistant Secretary for being here as well, and thank you for your service. I think this hearing, obviously, I'm sure it tells you, and it certainly tells us here, how pointless these House Republican investigations are that happen in this committee over and over again. These investigations into the Biden administration and our public health officials are really quite shameful. We've been at this now for almost an entire year of these hearings, and with very little to show for it. Which is why we're sitting here arguing back and forth about whether or not HHS has been responsive enough to requests for information. And Mr. Chairman, I'd like to note that this is the epitome of a hearing that could have been an email. And there's no reason we need to sit here and participate in this hit job on our nation's health officials. It seems to be the case every time we have one of these hearings. Now, and let's also be really clear, these policies have been proposed not just by the Republican majority, but also by their Supreme Leader Donald Trump. We know that Donald Trump has already vowed to roll back health care in this country. He's vowed to roll back women's right to reproductive health. He's vowed to appeal Obamacare. He's vowed to kick people off their health care. He's vowed to eliminate and actually destroy the way we actually have Medicare in this country. And remember, let's also remind ourselves that many of the committee folks on this committee have also spent a large part of the last decade trying to actually dismantle Obamacare and kick millions of Americans off their health insurance plans. And again, we know Donald Trump just last week said he would like to repeal Obamacare. So the point of many of these of my colleagues on the other side of the aisle is essentially to kick people off health care, roll back Obamacare, attack our healthcare officials across this country, and do whatever they can to elect Donald Trump president again. And by the way, if you have a pre-existing condition, your health coverage could be gone under some of these Republicans' plans. And to that extent, before I was in Congress and certainly before I was in elected office, I was a faculty member at a university. And the attack, of course, on students and pre-existing conditions and young people having access to their parents' plan is also a consistent theme with the majority. Now, on top of this, we all know that Obamacare was critical to people's access to care during the pandemic and during the horrific period of loss of life that we had in this country. The pandemic has cost us more than 1.3 million Americans and certainly had a huge impact on my city. Can you share for my colleagues what the COVID would have looked like for the American healthcare system and the American people? if Obamacare had actually been repealed as most of the majority wanted to back when they made that last attempt?
Congressman, I actually want to be forward-thinking, and what I will say is I'm very glad that the ACA was available and the marketplaces were available for as people had job loss. There was coverage options, whether that was Medicaid, COBRA, or the ACA for coverage, and the support for individuals allowed us to recover from the pandemic and the economic impact at a much more rapid pace than probably would have happened had there not been that coverage.
Great, thank you very much. And I think that's absolutely right. We should be thinking about ways to expand healthcare coverage across this country, not take health coverage away. I want to just want to note that one thing that's really discouraging is this consistent attack on public health officials, on you, on all of our witnesses that come forward. And this is the same majority that encourages skepticism, as we know, of not just and attacks on our healthcare system, but our even COVID vaccination process and vaccines in general. They've encouraged, as you know, followers on social media to ignore recommendations of doctors, to ignore vaccinations for children, comparing getting vaccines to essentially causing mass harm to the American public, which we all know is both shocking and incredibly irresponsible. During my time as mayor, getting supplies, getting vaccines, getting masks, getting PPE to the public was incredibly important. Last year I introduced the FLASH Act, which helps HHS cut through red tape and get critical medical supplies like PPE, tests, and vaccines during emergencies. Just lastly, how do you think the FLASH Act would impact HHS's ability to get these supplies?
Congressman, I don't want to speak to specific pieces of legislation, but what I can say is investments in PPE, investments in supplies, the ability to make sure people have the health care they need and the protection they need when they need it is critically important. And we are happy to work with you or any member of Congress on legislation to meet those goals.
Thank you very much. And with that, I yield back.